So you'll probably get a prompt that says recording in progress. Okay, all right, here we go.
Okay, so I'm going to get us started with a few introductory slides. So what our agenda is going to look like this morning, we're going to start by talking about some of the goals and objectives of Project Early to give you guys some context. Then we will kind of dive into some of the detailed aspects and requirements of the program. And we'll conclude with some discussion of what the application requirements and enrollment process looks like. And just a disclaimer that this project is obviously a grant-funded project, but we want to make it clear that the contents of this presentation don't necessarily represent, nor are they endorsed by the U.S. Department of Education, which is our funder for this project. So what does the acronym EARLY stand for? You can see it's evidence-based action, research, and learning to support young children with or at risk for autism. And I think the title of this project really captures kind of the three prongs that we're looking at, right? Action refers to the field-based applied components of the project. Research refers to the collaborative research opportunities that students will be expected to participate in. And learning refers to the shared coursework that students in this project will take with that kind of blends together the worlds of ABA and school psychology and early childhood, all of which is going to occur within the context of evidence-based practice, and all of which is for the purpose of serving young children with or at risk for autism. So this really kind of captures the heart and the goal of this program. OSEP is our funder. So OSEP is the Office of Special Education Programs, which is under the umbrella of the U.S. Department of Education. And every year, OSEP has a series of grant opportunities that are specifically aimed towards addressing shortages in the field of education. So this project in particular was designed to address shortages in BCBAs and school psychologists working in the schools. So that's kind of the context for this for the funding of this project. This is our awesome team. So Dr. Leslie Neely is our principal investigator, and she and Dr. McNull represent kind of the ABA side of this program, and myself and Dr. Castro Villarreal represent the school psychology side of this program. Dr. Victor Villarreal is consulting with us on the cultural and linguistic diversity aspects of the project. And then Dr. Ileana Alanis is consulting with us on the early childhood components of this project. So you can see that we have pulled together expertise from not only our department, but the interdisciplinary learning and teaching department as well, to come at this project from multiple perspectives. And these are some of the other collaborators that we have. And you can see several of these are within the University of Texas at San Antonio. And you can see that we also have some community-based partners as well that we have. We established a pretty long history of working with these collaborators. So they're excited to be involved with this as well. And we'll be providing some of the field-based sites and supervision for some of our coursework and field-based experiences. Dr. McNull, is this where you take over?
Not yet. 3 more slides.
Oh, just kidding. So as I said earlier, the goal of the project is to increase the quantity and quality of BCBAs and school psychologists who have additional expertise in culture responsive services and early childhood services. Again, specifically with the goal of serving infants and toddlers at risk for or diagnosed with autism spectrum disorder. Several reasons why this is important. We know from years of research that the earlier kids with autism or suspected of autism get services, the more effective their outcomes tend to be. So So there's a big focus in the research and grant funding right now on early identification and early intervention for these students. And we know too that it has to be a team effort. So we're looking at behavior, we're looking at speech and communication, academics, nutrition. So it makes perfect sense to blend the expertise of the field of ABA and school psychology plus early childhood. We know that all services need to be provided within the context of cultural responsiveness. So understanding where students are coming from, understanding the needs of their families, and being able to respond to those needs and provide services that are going to take those needs into consideration. We also know, as I mentioned earlier, there's a huge shortage in BCBAs and school psychologists, especially those who are able to train with one another in a collaborative kind of effort. So that's what this project is responding to. So you can see we have education plus experience, all with the goal of increasing our ability to identify autism symptoms earlier, which leads to earlier diagnosis, which means that we can start treatment earlier across different settings, whether that's in the community, in clinical settings, and home settings, and educational settings. So it's not just more coursework or more field-based experience, it's really both, and coming at it from both a classroom-based orientation and a field-based orientation.
All right, thank you, Dr. Sullivan.
Yeah, thank you.
Yeah, so we're going to talk a little bit more about the details and what all Project Early is going to encompass from the scholars experience. I'm going to go through these slides, and as I mentioned before, we're going to save time for questions after, because I know you probably have specific questions related to what it would look like, you know, from your perspective, or what program you're interested in. So just bear with me as I go through these. I'll make sure that we have time at the end for questions. Okay, so when I first came into special education, I was just inundated with all of these acronyms. And so I figured we would just start out by talking about, what do these acronyms mean? So there's two main components here, and one is the BCBA and one is the Lssp. So I'll start with BCBA. What BCBA stands for is a board certified behavior analyst. And this is the professional credential that allows for behavior analysts to function as independent practitioners, providing behavior analytic services for individuals with a variety of abilities, a variety of ages and diagnoses. BCBAs typically work in a clinic setting, but we also provide services in home settings. There are oftentimes behavior analysts that work with school districts. And so kind of the marriage between behavior analysis and school psychology came about organically. And so we'll talk about that a little bit as we go through the slides. But I also know that y'all are interested in what do I get on for the return on my investment. And so the average starting salary for a BCBA over the course of 12 months is about $75,000. And I'm going to talk about how that's comparable to the compensation from the Lssp. So jumping over to Lssp, Lssp stands for Licensed Specialist in School Psychology. And this is specifically to, in regard to Texas, the credential that permits the practice of school psychology in the schools. So this license is required by the State Board of Examiners of Psychologists to provide psychological services in Texas public schools. And what an Lssp does for, they wear many hats, but a majority or primary function of an Lssp is to conduct assessments to determine needs for students that might benefit from special education services, and then map out what those services might look like. The average starting salary for an Lssp for 10 months is about $60,000, but there's also non-monetary benefits to working in the schools because you have all of those programmed holidays, you have the summers off, and so it's nice that you have the flexibility and you follow the school schedule with overall less days that you work throughout the year. So when you take the time and the amount of compensation that's allocated to each professional discipline, they come out to be about equal given the amount of time that you work. So for Project Early, we have an overall method that will prepare scholars to cross-train in applied behavior analysis, school psychology, with an emphasis on early childhood subject matter. And the overall goal is to prepare scientist practitioners who can identify early signs of autism spectrum disorder and provide culturally responsive and developmentally appropriate treatment. So to accomplish these goals, there's various competencies that serve at the foundation of the project. And these include skills that we aim for all scholars to be able to demonstrate. And so this is across both disciplines. These competencies, I'm going to explain each of them individually, but we expect all scholars to know how to identify quality and evidence-based practices when providing services to individuals with high intensity needs. People keep popping in, I'll just keep letting them in. Fidelity in implementing those key ABA assessments and interventions for individuals at risk or diagnosed with autism spectrum disorder. So we first have to conduct the assessment to identify the needs and then consult the literature and the support that we have for evidence-based practices in regard to our treatment approach. We also want our scholars to have high fidelity in collaborating with other early intervention specialists in authentic settings. And so what that means is oftentimes when we work with individuals with high intensity needs, one practitioner cannot provide all of the services. So we consult with school psychologists, behavior analysts. We're also going to have guest speakers on speech and language pathology, occupational therapy, child developmental specialists. And so how do we work together as a team to ultimately provide and benefit the needs of the individuals that we serve? We're also going to discuss early symptoms of autism spectrum disorder and the diagnostic process. So that's oftentimes something that if you go into applied behavior analysis, you don't get to see all of those processes. We just are referred clients that we serve, but we don't see all of the things that occurred before they come in contact with us that led to that diagnosis and what those symptoms look like. And so that's one area that we're going to focus on within the project. And I'm going to speak more about that when we talk about the field-based experiences. We also want to hit on the fidelity in partnering with families in socially acceptable processes. So just like the comprehensive treatment team consists of a variety of practitioners, one of the biggest stakeholders in the development and the carrying out of these treatment plans are the caregivers and the families, because they're with them all of the time that the individual practitioners are not. And so we look at this as a comprehensive and holistic approach to the development of those treatment plans and what that will look like long-term after the individualized intervention is either faded out or removed completely. We want the families to be able to continue to carry out those services so that the benefits generalize over long periods of time. And then the biggest thing that we really hit on with it when we were developing this proposal is the culturally responsive intervention and consultation. So when we go to develop these treatment plans, there's not a one size fit all. It's not a bag of tricks that we pull out and everything works for every client. So what we need to do is look at the individual families that we work with, and we need to map on the interventions to be culturally responsive and appropriate for these families so that they are acceptable within the treatment plan. Okay, so in the previous slide, we talked about the various competencies, and mastery of these competencies are going to be in part acquired through field-based experiences and coursework. So in regard to field-based experiences, all scholars will engage in a variety of fieldwork placements throughout their time in Project Early. And so these include rotations that all scholars will complete. The first one that we have here is Autism Treatment Center. This is our university-based or partnered clinic that we've developed over the course of the past couple years. We've worked with them extensively, so a lot of our behavior analytics students, they have rotations or long-term employment at the Autism Treatment Center. And this is a clinic-based, it's a clinic that provides behavior analytics services, but they also are able to go into schools and provide services in home because they are a nonprofit foundation. So they receive funding through the CAP program, which is provide supplemental services to individuals that receive Medicaid benefits. And so that community partnership between UTSA and Autism Treatment Center has gone on to provide services to a lot of families that otherwise would not be able to access those services. We also have a partnership with the Children's Hospital of San Antonio. All scholars in Project Early will do a rotation through the Children's Hospital in order to look at the assessment and the diagnostic process of autism spectrum disorder. And then we also have within the Children's Hospital a subclinic that's conducted by Autism Treatment Center. So everybody's kind of working together, and the specific settings in which we provide these services for target or specialize in different populations. And so at the Children's Hospital, we are really looking at that autism spectrum disorder diagnoses. And then in the clinic side, we work with individuals who engage in more severe or challenging behaviors. So all scholars will get experience in that domain. At UTSA, we have a project play lab, and this is parent-led assessment and intervention for autism spectrum disorder for young infants and toddlers. The population that we serve at Project Play are infants age 0 to 3 years. And so all scholars will do a rotation through here by identifying needs based on assessments and then developing a treatment plan that is appropriate for the client's developmental age. And then last but not least, we have the Early Head Start Childcare Partnership. When I talk about coursework and we talk about the consultation class, typically when you do the consultation class, individuals get to choose where they are doing their consultation service learning project. But as part of Project Early, all of our scholars will collaborate with the Early Head Start. So you're working with those younger populations with high intensity needs. And Dr. Sullivan, if you have anything to add at any of these slides, feel free to jump in.
Thank you.
All right, so one thing that I've been getting quite a bit of questions on are in regard to the different programs. So I want to make it really clear that there's 2 program options, and depending on the program that you decide to pursue, that will inform the majority of the coursework that you complete. So there's 2 program options that scholars can take, and these are the BCBA track. So this is if you're interested in applied behavior analysis, and the Lssp track. So this is that school psychology track. Depending on which one you're in, majority of your courses and experiences will be centered around that discipline. But we do have certain courses that will be shared across both programs to allow for the cross-training and interdisciplinary subject matter. So on the next slide, we are going to look at both of those and see what's similar and what's different. So when we compare the 2 tracks, I've broken it down into kind of the things that might be important or that questions that we've gotten. So in regard to the duration of the time of the program, where the practicum setting primarily takes place, the courses, and then at the bottom, we have the shared experiences. So if you are interested in pursuing behavior analysis or the BCBA track, typically this takes about 2 years for our scholars to complete. The practicum settings are typically in applied behavior analysis clinic, and your coursework centers heavily on behavior analysis principles and include things like verbal behavior, ethics in regard to behavior analysis, behavior assessment, and then we have a capstone class in applied behavior analysis, which is kind of that final class where we prepare you to transition from student to professional. And so it encompasses a wide variety of things, but some of the main topics that our students really enjoy are like developing your CV, how to interview, how to scout different job options, how to negotiate a job offer, and things like that. And it also includes the final comprehensive exam, which you are required to pass in order to graduate from the program. But I know, don't let it be scary. All of our students have taken it and have passed. You just have to get an 80% or higher, and you have 2 chances to do that. And the reason we do it is because it very much so maps on to the state certification exam, the board certified behavior analyst exam. And so it's really to give you good experience with that type of testing format and know which areas to study before you go up to sit for the certification exam. In regard to the Lssp track, the Lssp track is that school psychology concentration, and it takes about 3 years for students to complete. The practicum setting, most of the students in school psychology will complete their practicum in a school-based setting because that is where their services are able to be provided. You'll take courses in legal issues in schools, so that's similar to the ethics class, but this is now centered on what that looks like in regard to school psychology. Statistics, you'll learn about school counseling and different counseling theories. Research design, and among others that I'll show the course outline, the degree sequence in the next slide. In regard to the shared experiences, so we've talked about the ATC internship, the Autism Treatment Center. We talked about the Children's Hospital of San Antonio rotation, conducting a case study at the Project Play Lab, so that's the infants and toddlers lab. But in addition to that, we will have what we call an early institute, and these are going to be monthly meetings from guest speakers that are going to talk about a variety of the topics that are of interest to Project Early. You will also receive training in telehealth, so how to conduct services remotely via telehealth, so like through Zoom. This is something that we've been doing for quite some time, but given the pandemic, it became super important. And so now we've just developed that as part of our curriculum, and we want all of our scholars to be able to provide those services, and not only just provide services, but provide high quality and evidence-based services through the telehealth mechanism. And then I talked about this a little bit previously, but the consultation class. So this is a shared course that all scholars will take, but instead of having a variety of settings that you can conduct the consultation project, you're going to be working at the early Head Start so that you're focused on early childhood education. In regard to the shared courses, so all scholars will take a variety of behavior analysis and school psychology classes together, again, to foster that interdisciplinary collaboration. So these classes include Intro to Applied Behavior Analysis, Principles and Techniques of Evaluation, Human Development, Practicum, that consultation class, Consultation in the Schools, Psychological Learning Theories, and Research in Single Case Design. And now when I go to the next slides that show the course sequences for each of the programs, there's an emphasis on certain classes because in order to sit for the board certified behavior analyst exam, you have to take 7 classes in what we call a verified course sequence. So something that I noticed, as I was transitioning from a student to professional is that it's actually really unique to be able to do coursework in both behavior analysis and school psychology. And UTSA is one of the few universities that allows for interdisciplinary study that way. And so when we were going up for this grant, we've been working on it for a couple years, and it's something that's near and dear to our heart because we already had some of these courses that were shared within the department. And so being able to sit for both the school psychology and the ABA side of certifications is really unique and something that we wanted to pursue. And so that's what I'll show in the next slides when I go over the course sequence. Dr. Sullivan, anything else here?
No, I think it's helpful, and you said this already, Dr. Magnol, but it's helpful for me to think of this as there are university requirements for both the ABA program and the school psychology program. And then there's this other layer of requirements that is specific to the early program. So one thing I would note is that after hearing this presentation, if you guys think maybe the early thing isn't going to work for me, or if it's not a good fit for me right now because it's just too much, that wouldn't stop you from applying to just the master's program in behavior analysis or the master's program in school psychology. So I hope that even if this program doesn't work for you right now, that maybe one of those master's programs by themselves will. So there's just a lot of requirements for ABA stuff, and there's a ton of requirements for school psych stuff. And then here's like another layer of requirements. So it's a lot for me to keep track of, to be honest with you guys. But Dr. Manal, you're doing a good job of differentiating those things.
Yeah, I hope I can kind of distinguish between the two as much as I can, but of course there's no limit on questions. And thank you, Dr. Sullivan, for bringing that up, because it's very important to know that there are university and program specific requirements, and then Project Early is really those shared experiences and how we can learn from each other. And so there are additional requirements, but I think we've done a good job of fitting that into what you're already expected to do in each program. It's just kind of tailoring. So instead of doing a consultation case at an elementary school or at a middle school, you're going to work at the early Head Start. So just shaping those experiences to be tailored towards early intervention with the layer of culturally responsive practice. Okay, so I'll start with the ABA course sequence. Our ABA students take about 2 to 3 classes per semester, but given the overlap in the shared courses, some semesters are going to be lighter than others. So for all scholars, the coursework starts in that summer of year 1, where y'all will take shared coursework in that intro to ABA class. And that's really important because that intro class serves as the 40-hour training to become a registered behavior technician. And so right out the gate, you're getting a certification that allows you to work as a registered behavior technician, which is important because that first year also includes the internship at the Autism Treatment Center. So working at the Autism Treatment Center as a registered behavior technician, you're able to start accruing the field-based experiences that are required to sit for certification. So in applied behavior analysis, that's 2,000 supervised hours, which our students have been able to accomplish within those 2 years. And so the sooner you can start on those, the better, because any work that you do prior to coursework wouldn't count. So you have to start your behavior analytic coursework in order to start counting those fieldwork hours towards the supervision requirements. So that's why we have it starting in the summer. Traditionally, we haven't offered this class in the summer, but in order to facilitate y'all to have experience in that domain early and be able to work professionally as a registered behavior technician, we're going to offer it in the summer. And then in the fall, you would take 2 classes, so research and single case design and principles and techniques of evaluation. The principles and techniques of evaluation is a shared course that typically our ABA students don't take. And so this is taught by Dr. Sullivan and would be a class that the ABA scholars would then start to learn the school psychology side of things. And then in the spring, these are the 3 typical behavior analytic classes. So behavior assessment, verbal behavior, and ethics. And then again, in the summer of the second year, you'll take another shared course in human development across the lifespan. And then in fall is when scholars start their practicum class. And this is both in behavior analysis and school psychology. So you're getting that field-based experience where either the behavior analytic students are working in clinics and the school psychology students are working in the schools. Then that last semester is when you take the consultation class. So you're doing that case study at the early Head Start. setting. Okay, then we have the Lssp course sequence. The school site classes, they typically, there's not a lot of flexibility here because of the requirements of the license. And so students take 4 classes in the fall and the spring, and then 2 classes in the summer. And it takes 3 years if you're going full-time. But that last year is a full-time internship. And so when students are in their 3rd year and they're doing their internship, oftentimes you're working as an intern, but you're also getting a salary. Oftentimes you're getting a salary. And so it's like a full-time job. It's a really good primer before you're out working independently as an Lssp. So the classes that I discussed in the previous slide, the shared classes are the same, but the Lssp course sequence here differs from the regular school psych sequence because it includes those ABA classes. So it does include the 7 classes in the verified course sequence to sit for that BCBA exam. So the last thing I'm going to talk about is the Early Institute. And so these are monthly meetings that we call the Institute, and they include, it's a professional learning community, which is aimed to provide support in retaining personnel in early childhood, special education, related professions. And so within the Early Institute and within these meetings, we're going to have a variety of invited expert topic speakers. So we're going to have people from the Children's Hospital of San Antonio that run the Autism Diagnostic Clinic. We're going to have individuals that work in the schools. We're going to have individuals that work in the clinic. We're going to have individuals that are specialized in early childhood and culturally responsive practices. And so within these meetings, we're going to gather as a group and we're going to listen to these invited speakers. And we're also going to kind of roundtable and discuss our case studies and our research projects that we're going to work on together and get feedback. So oftentimes if you're in the behavior analysis program and you're conducting research on a topic in applied behavior analysis, you're in a lab with behavior analysis students. But one thing that's missing is that information or that feedback from other disciplines that we know are critically important in serving individuals with high intensity needs. And so I'm really excited about this piece because it's going to allow for a wealth of ideas and really collaborative approaches to our research questions. You will complete a variety of OSEP webinars, and what these are the webinars from Office of Special Education Programs. And so the Office of Special Education Programs focuses on developing or conducting research to really disseminate evidence-based practices. And so those are always not always changing, but new practices are being added and new research is being produced. And so it's important to stay up to date on those things that are coming about and of recent research. And so we will have the scholars complete these webinars online. And then lastly, we're going to discuss seminal. And so what that means is like the main papers across these disciplines that have really shaped the field as to who we are today. And so it's going to be really exciting to read about these studies that are in behavior analysis, in school psychology, and early childhood, and then engage in fruitful discussion about what this means and how this might apply to the different disciplines and areas that we're interested in working. And so all of these things that we've talked about, the coursework and the field-based experiences, are going to center around partnering with families and those other early childhood specialists. And so that's where we're going to be focusing on during those Early Institute meetings. So when we're engaging in those discussions, when we're getting feedback from our other professionals and other topic experts in the field, we're going to look at how can we take these evidence-based practices and how do we add, some of the things that we've learned from other disciplines. And so it's going to really focus on working together and really leaning on each other's expertise to develop interventions and treatment plans that are going to be comprehensive and holistically beneficial for the people that we're serving. All right, into the good stuff, outcomes. So what happens after you do all this stuff? You're doing all these field-based experiences, you're taking all these classes. What do you get? Well, upon graduation, depending on the program that you pursue, you will get a Master of Arts in School Psychology or a Master of Science in Behavior Analysis. And so this is really exciting because you're graduating with a very content-specific master's degree. And I found that to be really exciting, and that's something we're really looking forward to bringing on board, because it very specifically states what you are a master in and what you have acquired experience through. And upon graduation, we kind of hit on those certifications, but because of the cross-disciplinary training, scholars will be able to sit for the qualifying exams that are necessary to become either a BCBA or an Lssp. So I do want to take a moment here and say, if you're in the Lssp program, you will be able to sit for both the Lssp and the BCBA credentials, because you're going to be taking the shared coursework together, as long as you fulfill the requirement of the 2,000 supervised hours in applied behavior analysis and the 1,500 hours in school psychology. It is a lot, but I've done it. I can speak from experience that it's possible. And this was definitely a consideration that we took very seriously when we were thinking about how to design the coursework. And so that first class, that first intro to ABA class is so important, because that lets you start immediately in that summer accruing the ABA fieldwork experience hours. And then in year 2, so if you're in the school psychology program, in year 2, you're doing your practicum. And Dr. Sullivan, remind me, about how many hours a week are the school psych practicum students working?
10 to 15 hours a week at a campus.
Perfect. So about 10 to 15 hours a week. And so if you are working in that first year, starting in the summer as that internship at Autism Treatment Center at about 25 hours a week, so for summer, fall, and spring, and then you're working on research and these other activities that also count as field-based experiences, by the end of the 3 years, you should be able to accrue the 2,000 supervised hours, because in year 3, that's when you're working full-time as an Lssp intern. So we want you to have all of your ABA hours accrued by then. And then if you're in the ABA program, you can't do both the Lssp and BCBA because you saw all of those courses, but you are going to have specialized training in school psychology. You're going to know how these clients come to be on your caseload, and you're going to be able to understand the assessments that come in their document review. You're going to understand the symptomatology and how those progress over time and what you're looking for in terms of your behavior analytic approach. And so I just wanted to clarify that if you do the school psych program, you can be eligible for both the BCBA and Lssp. If you do the ABA program, it's 2 years, there's a bit less coursework, but you still have to accrue the 2,000 supervised hours, but it will only allow you to sit for the board certified behavior analyst exam. Okay. All right. So next I'll hand it back over to Dr. Sullivan to talk about application and enrollment.
Okay. So we do want to make a point that this is a full-time commitment to the program. There is not going to be an online option for the courses that are offered in this program. And if you think about what the program is trying to accomplish, and you saw what some of those different courses were, it makes sense that basically we need you here. We have people going out to school sites, to clinical sites, multiple places throughout the week. A lot of our courses are hands-on. We need to observe you doing things. You need to observe us doing things. And it's just logistically, I don't know if impossible is accurate, but really, really difficult to do that virtually. So even with the current context of the pandemic, and we've gotten a little bit more flexible about how we offer our coursework. For this opportunity, we really need it to be in person, face to face, on campus. So some of the UTSA requirements for graduate programs in our department, you have to have a degree from a regionally accredited college or university. And in terms of knowledge, usually that degree is going to be in psychology or education or some related field. We have some flexibility there, and we can figure out those things on a individual or case-by-case basis. We've had students from backgrounds in sociology or social work, the social sciences defined broadly, if that makes sense. And if you were coming from a background in English or history, sometimes we have those students as well. And we welcome them, we welcome you. It's just a matter of getting some background courses taken care of before you start taking the actual degree related courses. And again, that stuff is best handled on a case-by-case basis. For the GRE, we do require the GRE, and I think the writing section is the one that we have a specific cutoff for. We were looking for a 3.5 or higher on the GRE writing test. There is not a specific cutoff for the verbal or quantitative sections. And the GPA requirement, you can see, is a minimum of 3.0 in your last 60 semester credit hours. So I know my wife is recently applying for a master's program, and she was really worried about her GPA, undergraduate GPA, not being very good. Fortunately, they only looked at the last 60 hours. So basically, if the first couple of years of your undergrad weren't great, or you're still trying to figure out what you wanted to do, what you wanted to major in, that's not going to be held against you. It's really the last 60 hours that will be taken into account in calculating that GPA.
We have had some students that just barely miss that cutoff. And oftentimes what I'll do is encourage students to go back and take some additional classes, because it is the last 60 semester credit hours. So if you go back and take some classes and get A's in them, it'll bring that average up. And so that's also something that we can look at and help you with on an individual basis.
Yeah, good point. So don't see that as a all or nothing kind of thing. There's room to work that out if we need to.
Yeah, and something I don't think we said so far is that this is going to be over the course of 5 years. And so if you're considering a master's program and maybe you need to take a couple of those classes to get your GPA up, or you haven't taken the GRE yet and are not sure that you'll be able to get it done by the April 15th deadline, we're going to be doing this over the next 5 years, and bringing in 10 scholars is our goal every single year. So 5 from ABA and 5 from school psych. And so this is not a one-shot type of deal. And so just something to consider as you're, learning about the program and seeing if it'll be a good fit for you.
Excellent point. So if you can't have all the paperwork or requirements fulfilled for this year, think about next year. Yeah.
Yep, for sure.
So those are the UTSA requirements. Some of the program specific requirements, in addition to those basic requirements, we do want a current resume that would detail any related professional experiences you may have had, 2 letters of recommendation. We are doing an interview with selected candidates, and really this is just to make sure that it's going to be a good fit or a good match for your professional goals and interests, and a statement of purpose describing why you're pursuing a graduate degree, and specifically why you want to participate in this program, and how it can help you get to where you want to go. terms of the timeline, so our application deadline is April the 15th. And then between April and May, we would be doing interviews with selected candidates. And then the Summer Institute would be starting in June. So kind of a lot's going to be happening in April, May, and June. And then classes typically start like the third week of August or so, late August. Okay, here's the one that we've all been waiting for, probably, right? What's in it for me, right? So in terms of the funding opportunities for students, everybody would get a $13,000 stipend to cover their tuition, in addition to $500 for technology, $500 summer stipend, $250 research materials, and then a $1,000 travel budget. So you can see in total, this is over $15,000 that the program would be investing in you guys, in addition to opportunities for paid internship, supervision, and the interdisciplinary coursework. The catch, or the caveat here, is that, you know, that from the federal government's point of view, they're saying, okay, we're investing over $15,000 in you guys' education. The payback is they want you to commit to working in South Texas for 2 years following graduation with your degree. And for most people, that's not going to be a big deal. I don't think. If a lot of us are coming from South Texas anyway, we're already interested in working in clinical settings or school settings, providing these services. It's like, this is something that probably we would be doing anyway, right? But it's, again, it's kind of showing how we're making an investment in our community, essentially, right? But before we turn it over for questions, I just want to say, you know, I've been working with the faculty in this program for years, and they know what they're doing. They care about students. We are a very student-centered department, and I think now is a really good time to be a roadrunner. Side note, we just won our first conference championship last night in the Alamo Dome, so we're very excited about that. Right.
Yes, good point. And absolutely, I've never worked in a department that is more collaborative, friendly, and very student-centered. And I know that because I was a student and I had a great student experience and I wanted to come back here. And so I appreciate you bringing that up, Dr. Sullivan, because it's super important and something that's not always of the focus at other places that I've been in. So it's really unique to UTSA. Mm-hmm. All right, so I think we will turn it over for questions. I do have 2 in the chat that we'll start with. So one is about the GRE, not being able to take it by April, but took it in your master's program, or you took it and did well for your first master's. So Dr. Sullivan, is there a expiration date on the GRE requirements? Or if we don't have that answer, I can definitely look into it and get back to you.
I want to say it's 5 or 6 years, but yeah, we can nail that down more specifically if we need to.
Yeah.
I think Sam would know that for sure.
Absolutely. Okay. And then we have another question from Jasmine. She says, what does the federal government consider as South Texas? And that we worked really hard to define it as loosely as possible. And so I think we said basically anything. What was the things that we said? I think it includes like Austin, San Marcos, Corpus Christi, Victoria, the like El Paso, I think we considered. So let us know what you're interested in and we can check on that for you. But we did try to define it as loosely as we could.
I have a friend who works in the Rio Grande Valley, and she always gets miffed when I refer to San Antonio as South Texas. She's like, no, Brownsville is South Texas. So yeah, we tried to be deliberately vague there.
Yep, absolutely. Is it possible to work while doing this degree? So it's very comprehensive, the Project Early, because of that internship. You're going to be working about 25 hours a week in that first semester or that first year. And then you have classes at night from 5:30 to 8:15 p.m. And so that also comes with the time that's spent outside of your classes to do the work. So we do not recommend, I try to stay away from the word impossible, but I do not think it would be advantageous to try and work during participating in Project Early. Now, if you do the degrees independent of Project Early and you maybe go on a part-time basis, that can sometimes work. But depending on school psychology or ABA, you're still going to need to obtain those field-based experiences. And so there's going to have to be a time where you're able to allocate either time to work towards the ABA side of things or working in that internship. But again, oftentimes those placements are paid. So let's see, lots of questions. What kind of supports does your program provide for out-of-state students? So, wondering, I know that we've done a lot, Dr. Sullivan, within our department to try and provide, whether it be GRA positions or GA positions, to allow students to get in-state tuition if they're coming from out of state, but I don't think it's something that we could guarantee.
I would love to be able to, yeah, but since the number of GA positions and GRA positions fluctuates a bit from year to year, depending on funding from the college, we can't make those guarantees, but we can say that for the most part, typically students who are interested in those positions are able to find one, even if not in our department, in maybe the counseling department or the ed leadership department, which are also housed downtown. So it works out really well. In other words, we're able to find something for those guys to get them in-state tuition.
Yeah, even the principal investigator on this grant, Dr. Neely, she found that in our operating procedures that if there's a competitive student scholarship, students can get in-state tuition. So we allocated funds to a variety of competitive student scholarships to try and get more students in-state funding. So whether they're out of state or international and things like that. So we are always working to provide funding for students that come from out of state. Okay. So the internship is ongoing and paid throughout in addition to the funds of $15K. That's correct. So in that first year, the internship at Autism Treatment Center, I can't remember exactly how much they pay, but it is paid. And I think it comes out to maybe about 12,000 or so. And so if you saw the flyer that said compensation of around 25, that's incorporating that paid internship. And then also the supervision that you'll receive. If you're not part of a program like this that is comprehensive, individuals oftentimes have to pay for that supervision. So that's also another non-monetary benefit, but you could calculate it out to be a financial incentive. Did that answer your question, Jasmine? Let me know if it didn't. Okay, another question about out of state. So we talked about that. Intro to ABA makes you an RBT, but what if you're already an RBT and already trained? Then it's just a required class for you. So the intro to ABA satisfies the 40-hour RBT training, and then your site supervisor would administer a competency assessment, and then there's an RBT exam that you have to take. But if you're already an RBT, that's totally cool, but it's still part of the required course sequence. Where can we find information to take the GRE? I want to say that's on the GRE website, Dr. Sullivan.
Yeah, it's administered through Educational Testing Service. So I think it's ets.org.
Yeah, that sounds right. ets.org. And I think that's where you can see the testing dates and register and sign up and all that stuff. Jasmine asked, can any of my prior coursework or experience be counted toward the degree? So it depends on what the coursework was, but if you are starting the ABA or the school psych program, because it is outlined by the accreditation boards, oftentimes you have to take the course sequence that's offered in its entirety of the program. But that's also something that we can look on an individual basis. Alyssa asks, where can we specifically apply for Project Early? So that will be included in your application to the specific program. So if you're applying to school psychology, you would do the graduate school application, indicate interest in school psychology, and then in your statement of purpose, say that you want to be considered for Project Early and you're interested in working with early childhood special education populations. And that's how we'll know. We don't want to make you do a million applications, so we just put it into one.
And also, you know, while you're doing that, if you're from out of state and you know you're interested in a graduate assistantship, maybe indicate that in there as well. So we can just kind of maybe have a list going of students who are interested in those opportunities.
Yep, I think that's a great idea. Rosa asked, would there be any additional coursework if we have a strictly early childhood background? So I think the coursework would be the same. That just satisfies the prerequisite of having experience either through your coursework or through previous employment in a related discipline. What are the main differences in the regular LSSP Master of Arts program compared to Project Early?
I think the big thing is the 3 additional courses that you would take as part of Project Early, the 3 ABA courses, and then some of the field-based experiences would be a little bit unique as well. So the school psych, you know, for the most part, our practicum and internship components are school-based, you know, they're campus-based. Some of the experiences in early would also expose you to more clinic-based services or community-based services. So the nature of what we actually do wouldn't look that different, but where we're doing it in a clinical setting versus in a school setting. So really it's meant to give you a more well-rounded kind of perspective of what autism looks like and what the services look like beyond just what we can do in a school setting. Mm-hmm. And also the research requirements would be unique to Project Early as well, where there aren't, since the school psych master's program is so long, it's a 66-hour program, and we have so many requirements. Students are not required to do a thesis or any research experiences, but in Project Early, you know, the early scholars will be expected to participate in research teams and that kind of thing.
Yeah, good point. Another student or person asked, right now I'm working in my bachelor's for special education. Do I need to finish it first to start the program? You need to have an expected graduation date before the start date of the master's degree. So again, I just want to reiterate that we're going to be doing this over the next 5 years. And so if the timing doesn't exactly map up right now for cohort 1, that's okay. You can still apply again in cohort 2 or year 2. Darla, thank you for posting the link for the ETS testing site. That's there available to you in the chat. Asbel says, in regard to working as an RBT and accruing 2,000 hours of supervision, can the internship be done at the center you are already working at, or does it have to be done at the ATC? Great question. So if you want to participate in Project Early, then you would have to do your field-based experience at Autism Treatment Center. But if you're going to pursue just the ABA master's degree, we have 2 options. One is the comprehensive, in which we provide placement at our educationally approved sites. But we also have the focus program, where it's just the coursework, and then you can get the field-based experiences at wherever you're currently working. So a couple options there. Rosa asked, does the stipend cover all tuition fees? Would there be other fees for which we would be responsible? So I believe the stipend covers 1 year of tuition fees. Is that your understanding as well, Dr. Sullivan?
That sounds about right. Yeah.
Yeah,
There-
I think it's about 1 year. And then other fees for which they might be responsible for.
One thing that might be helpful, and I wish I had thought of this ahead of time, but there is something on the graduate school website that gives you estimated cost of attendance, based on how many hours you're registering for per semester. So you can kind of extrapolate that, across 4 semesters or 6 semesters, whatever ends up looking like, to get a pretty good handle on what the total cost would be in terms of tuition and fees.
Yeah, that's a really good point, because especially in year 3, if you do the school psych program, you're taking 1 class in the fall and the spring. So that's definitely something that I would utilize that tool to kind of give you an overall projection of what the cost would be, and then incorporate the potential stipend there as well. Good point. All right, working my way through the questions. Awesome questions, y'all. These are really good. In what ways does an elementary education background aid in ABA? Oh, sorry. So elementary education background can help in ABA. So I can think of it 2 ways. My first year in my master's program, I was teaching a pre-K class, and I had no experience in behavior analysis. And man, if I did, I would have been a much better teacher, and I would have not been so kind of exhausted at the end of the day. And so I think they go hand in hand so well together, because a whole subset of applied behavior analysis looks at classroom management and how to promote contingencies that benefit learning and compliance and structure. And so I think that those go really well. And so if you're coming the opposite way, where you have experience in elementary education, that's then going to influence the information that you have and contextualize it when you're learning about different principles through behavior analysis. So good question. I think they work very well together. And what I would have done had I had experience in behavior analysis before going to teach would have been a totally different experience for sure.
You might still be doing it. Who knows?
That was a 1 year, and I was out. I was done. All right, very good. All right. If I got accepted in the spring semester, how does the coursework add up if I get accepted into the program? So Sarah, this is something we talked about during your advising. It doesn't change anything in regard to the courses that you have to take. There are just going to be certain semesters that are lighter and certain semesters that are have more courses, and that's why I recommended that you start with the ethics class, and that then you can do the intro to ABA class, because I think you're taking your ethics and then the elective. And so in the summer, you would start the intro to ABA class, and you would line up, you would be in line with all of the other Project Early scholars. Will you be sending this recording to all of us for those that are not able to attend? I think we're planning on posting this to the website.
Yep.
Yeah. So as soon as it's done kind of processing, I will for sure post the link on the website. Being that this grant funding is offered for 5 years, what are the chances of this grant being extended for more years? Great question. We're going to try for it. I think it just depends on how the Office of Special Education Programs funding is going, and if we're able to produce really solid practitioners that go on to serve the community, that always bodes well for future applications.
Good point. A lot of it depends on how well this first round goes and what kind of outcome data we can provide. And there's always fluctuations in federal funding, but there's been some lean years and there's been some more plentiful years. So a lot of moving parts, but definitely the goal would be to keep it going.
Yep, absolutely. Asbel, you asked me to repeat my answer to the internship hours. So if you're in project early, yes, you do have to complete your internship at the Autism Treatment Center. If you do not pursue project early, you can still do our master's program and complete your field-based experiences at the clinic that you're currently working in. I hope that clarified that. Okay, scrolling back down. Are any years of classroom experience required before being certified as an LSSP?
Nope, unlike the school counselor certification in Texas, school psychology does not have a requirement of 2 or 3 years of classroom teaching experience. So if you don't have any, no worries.
Yeah, good point. I remember I applied for school counseling and was so upset that I didn't get in, and I realized they said, well, you have to have been a teacher. And I said, oh, I didn't know that. So great question. Okay, clarification, the 25,000 funding package is only for 1 year of the degree. So the tuition stipend is for 1 year, and then I think it comes out to be about 12,000 for the ATC internship. So that's also in the first year, but the traveling stipend and the research materials, those will come into play in year 2, because that's when you're going to start working on those research projects. Michelle asks, if I already took the intro to ABA class at UTSA in undergrad, will I have to take that again for this program? Yes, that's correct, because they are different classes in the verified course sequence. So I believe you would have to retake it, but we can definitely double check when we go for advising. Good question. Rosa asks, if the stipend is only available for the first year, then we're responsible for paying the other years. Yes, that would be correct. Michelle asks, how many students in this program are we accepting in total over the years? So 10 scholars each year for the next 5 years. So 50 total is our goal. And within each year, we want to have 5 from ABA and 5 from school psychology. Okay. Oh, there's another question. What would the application timeline look for someone graduating in fall of 2022? Would you start in summer 2023? Good question.
I think so.
I think so. Yep. Yes. Okay, I think that's all the questions that were in the chat. If you have additional questions, feel free to unmute your mic, and we'll kind of hang out here for a little bit. But if there's no further questions, I appreciate you all being here today and taking the time on your Saturday morning. And there's no limit on questions. So if anything comes up, feel free to email me, Dr. Sullivan or Dr. Neely. And you can definitely check out our website. I'll post it in the chat box.
I do have a question.
Go ahead.
It's regarding the settings that a BCBA and an LSSP can work in. What is the process like for a BCBA to be able to practice in a school setting?
So if you pursue the ABA program, there's no additional requirements in order to work in a school setting. And so part of Project Early will set you up really well for that, because you're going to have experience working in the schools because of the shared coursework and because of the service learning requirements. But our master's students, our traditional master's program, they still do a school competency. So there's no additional certifications or things like that. It's just getting experience. If you're interested in working in the schools, then we oftentimes will foster a more comprehensive school-based experience for that student.
Okay, thank you so much.
Yeah.
And then I did have a question I just wanted to clarify. So my bachelor's is going to be in interdisciplinary studies. It's a background in education. The plan was to be certified in early childhood through 6 ECL. So would that be okay to apply for either of these programs, LSS, or either of the tracks, LSSP or the BCBA? Is that close enough related?
Absolutely, yeah.
I figured, but I just wanted to make sure. Thank you so much.
Sure.
Hi, I had a question. So I will be graduating in this coming spring. And I remember Dr. Sullivan was talking about how our GPA, like we need a 3.0 GPA in the last 60 hours of our degree. If like when I apply, I won't be done yet. So how would those 60 hours work if you know? Like, would it be like, even though I haven't finished the classes when I want to apply, would those last classes that I'm gonna take this semester, would they count, or would it be like the other ones not counting this spring semester?
I get your question. So what happens when you submit your application is you'll submit a unofficial transcript, and then Samantha Cienfuentes, our administrative associate, will look at that unofficial transcript and calculate the last 60 credit hours that you've earned up until that point. If it's below a 3.0, you can always you can always send your final grades after you complete the last semester and ask her to recalculate that. But
Okay.
if you submit in April, then you're not going to have your spring coursework done. So your grades will be based off of the classes that you took prior to that spring semester.
Okay, thank you so much.
Yeah, you're welcome.
Glad you knew the answer to that one. I wasn't sure. It's a good question, though.
I have another question. I was just thinking, is there anything besides just meeting the requirements that would make you a better applicant for this program? I'd like to apply to the Lssp program. Is there anything besides just getting a good score on the GRE or, having the right GPA that would make me stand out to get in?
Oh, any relevant experiences with schools or working with kids with disabilities or just children in general? Any volunteering opportunities that you've done? Any way that you can kind of make your interest in the field stand out.
Like if I had my RBT certification before, that would be good.
That would be cool. Yeah.
Okay.
Any like undergraduate research experiences too, working with faculty. Yeah, that's all I can think of at the moment.
Thank you.
Sure. Thank you all for being here on a Saturday morning, now Saturday afternoon.
All right, if there's no more questions, I hope you'll have a wonderful weekend. Stay safe.
Take care. Nailed it.